It won't hurt, I promise. Thanks, Patrick. All right, so let's have you flex your arm, flex your shoulder to 90. Okay, and then back down. When Patrick flexed his shoulder to 90, what type of contraction was that?
Concentric.
Okay, go ahead and flex for me again. What muscles forming that action?
Anterior deltoid.
Mhm. So when he gets to 90, and then he lowers back down from 90 to 0, what type of a contraction is that?
Eccentric.
What muscles?
Anterior deltoid.
Still the anterior deltoid. So they concentrically lift up to 90, and then they eccentrically lower back down to 0. Lifting up, we're going against gravity. Lowering back down, we're going with gravity. Okay, so eccentric going with gravity. Now let's have you stop at 90. Okay, it's pretty balanced right here. The world changes above 90 degrees. So now if you flex all the way up to your end range, I heard that. And then back to 90. So if he's going from 90, shoulder flexion above 90 in supine,
Would be eccentric.
going with gravity, it's eccentric. What muscles?
Posterior.
What else? Lat.
That.
A lot of lat. There's the lat is going to be your main muscle that's allowing eccentric shoulder extension. So then when he comes from his end range up to 90, what kind of contraction?
Concentric.
With gravity or against?
Against.
What muscles? Same muscles. So if you are trying to strengthen a patient, say Patrick has a right shoulder issue, he's got some limited range of motion, I'm having to do this actively to help his range of motion, and I decide to add some weight because I want to strengthen his flexion. If I give him a weight and have him go overhead, am I strengthening his flexion, his muscles that create shoulder flexion?
No.
Right, right. So think about your goal. If I want Patrick to have more range of motion, I can have him, and he's, to get to 90-ish, 100, I can have him lie in supine and do his full range of motion actively and have gravity help him. You're stretching the lats and you're eccentrically lowering into flexion. You're not strengthening the shoulder flexors, you're not strengthening the anterior delts, but you are assisting the flexion motion. So I can give this to him as a range of motion exercise, but then when I want him to strengthen flexion, I need to have him change positions. I need to have him sit up, or I need to have him in standing, so he's actually getting gravity resistance and that extra weight if we go anywhere above 90.
When he's coming back up to 90, he's moving against gravity with his anterior deltoid, so he is contracting and he is strengthening flexion.
He's using the lats to come back up. So he's using lat and pec to come back up. He's not using, this isn't using anterior delt going from 180 of flexion in supine. If I used a cable machine, or I used a lat pullover machine, I'm using my lats the whole way through. So he's using the opposite muscle. He's not using the shoulder flexors in supine from 180 to 90. Okay, he's using lats. Then when he goes back down from 90 down, he's eccentrically using anterior delt. So think about what changes in the system. If you're standing or you're sitting, concentric, anterior delts, concentric, concentric, concentric. As I lower back down, eccentric, still anterior delts, eccentric, eccentric. If I'm in the water, anterior delts, concentric, concentric, lats, 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 concentric, 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 because I have that force the whole entire time. Okay. Now I'm going to get you to roll over into sideline either way. Okay. Okay, so we talked a little bit about facilitating the scapula in sideline. So if you just rest your arm against your body here. If I have Patrick abduct his arm, up to 90, and back down. Okay, what muscles are creating the abduction?
Delts.
So he comes up, is it concentric or eccentric?
Concentric.
Concentric, then as he lowers back down,
Eccentric.
switches to eccentric. Yes, yes. Okay. Now, what if I have him, now flex your shoulder from this position, so you're coming forward and back. Oh my, what have I done? Oh no, what have I done? How did this change the whole system? Gravity is now eliminated. So your flexors are still working, but they're in a gravity eliminated position. Okay? So he's doing some flexor on the way up, then he's engaging some lats on the way back down. You can work range of motion without having gravity involved. So if I have someone who's having a hard time controlling above gravity, I can turn them in sideline and have them work gravity eliminated into some flexion. So all I want you to do is get the grasp of your position, where gravity is related to your position, or where your position is related to gravity. What happens if we add a band or something to this system? Okay, so let's have you roll back over onto your back, please. Fine. All right. So if I hook this around your foot, and you grab a hold of this, you can make a loop or whatever feels comfortable in your hand. So now do a shoulder flexion for me. Okay. How'd that change things?
There was resistance the whole way.
Now he's concentric from his side, so from 0 into full flexion, it's a concentric resistant motion of the shoulder flexors, so anterior delt mostly, the whole way. So nothing changed at 90, because now I have this extra force that's pulling against him, and as he gets his hand away from his foot, there's more force, more force, more force, so it doesn't switch over to the eccentric with the lats, because now he's got this force on his hand the whole way. So I could leave someone in supine, throw a loop around their foot and around their hand, and have them work some resisted shoulder flexion, keeping their spine straight. If I have somebody that can't seem to keep their body still, that wants to cheat, when I'm in the gym and I have patients that want to cheat when they're doing bicep curls, I back them up against a wall or up against a pole or something like that so they can't cheat. Well, you can do the same thing here at a low level and just put someone in supine. Now I'm using the band. Now I don't switch over from concentric to eccentric from 90 to 100. If I wanted to engage his lats, then I would have to switch the loop off of his foot and park it over his head somewhere. And then he would be getting concentric lat all the way down and then eccentric lat all the way up. Once you get the hang of it and you understand where your force is and you understand where gravity is and how your body fits in relation to that, you can come up with 1,000,001 different exercises. And when a patient's not able to perform the exercise that you had planned, well, I've got a modification. If you can't stand on the band and do this because you're losing your balance, or because you keep cheating and you can't make yourself stop cheating, then I'm going to have you lie down on the floor and do it. So that's your job as a skilled clinician, to be able to, on the spot, recognize an issue, make a modification, and give it to them right then, and not go, well, go home and try it for 3 days, and then when you come back, your low back's flared up and your shoulder's not any stronger because you've been rocking the whole time, using your glutes and your lumbar extensors to do this exercise. We can change the position and still get a functional exercise, still get our goal. So think about what muscles I'm working, how am I working them, what position can I put the patient in, what kind of a resistance